Good morning everybody. കേൾക്കാമോ?
Yeah, all good to go.
എല്ലാവർക്കും നമസ്കാരം. സമാജത്തിന്റെ 39ാമത് ഡോക്ടർ ലൈവ് എപ്പിസോഡിലേക്കാണ് നാം ഇന്ന് പ്രവേശിച്ചിരിക്കുന്നത്. നമുക്കറിയാം, ഈ കോവിഡ് ആരംഭിച്ച കാലം മുതൽ സമാജം വിവിധ മേഖലകളിൽ കമ്മ്യൂണിറ്റി എങ്ങനെ ഹെൽപ്പ് ചെയ്യാം എന്ന് മനസ്സിലാക്കിക്കൊണ്ട് പല പ്രോഗ്രാംസ് സ്റ്റാർട്ട് ചെയ്തു. അതിൽ ഏറ്റവും സജീവമായി നമ്മൾ കൊണ്ടുപോയിക്കൊണ്ടിരിക്കുന്ന പ്രോഗ്രാമാണ് ഡോക്ടർ ലൈവ് ഷോ. 39 ആഴ്ചകളായിട്ട് വിവിധ ഡോക്ടർമാർ നമ്മളോട് സംവദിക്കുകയുണ്ടായി. നമുക്കറിയാം, ഈ കോവിഡിൻ്റെ 2ാം വരവിൽ വാക്സിനേഷനും അതുമായിട്ടുള്ള ബന്ധപ്പെട്ട കാര്യങ്ങളാണ് കൂടുതൽ ജനങ്ങളിലേക്ക് എത്തേണ്ടത് എന്ന് മനസ്സിലാക്കിയതിൻ്റെ ഭാഗമായിട്ടാണ് ഈ കമ്മ്യൂണിറ്റിയിൽ വളരെ സജീവമായിട്ട് ഇടപെട്ടുകൊണ്ടിരിക്കുന്ന 2 ഡോക്ടേഴ്സാണ് നമ്മളോടൊപ്പം ഇന്നുള്ളത്. കഴിഞ്ഞ മീറ്റിങ്ങിലും നമ്മളോടൊപ്പം ഡോക്ടർ നിഷ നിജിൽ വളരെ വിശദമായി തന്നെ വാക്സിനെ പറ്റിയുള്ള കാര്യങ്ങൾ സംസാരിക്കുകയുണ്ടായി. ഇന്ന് മറ്റൊരു വിശിഷ്ടാതിഥി നമ്മളോടൊപ്പം ഉള്ളത് പ്രിയപ്പെട്ട നിജിൽ ഹാരൂണാണ്. ഡോക്ടർ വിശദമായിട്ട് സ്വാഗത പ്രസംഗത്തിൽ പരിചയപ്പെടുത്തും. എങ്കിലും ഈ കമ്മ്യൂണിറ്റി ഹെൽപ്പ് ലൈനുമായിട്ട് ബന്ധപ്പെട്ട് വളരെ സജീവമായിട്ട് പ്രവർത്തിച്ചുകൊണ്ടിരിക്കുന്ന 2 മുഖങ്ങളാണ് നിജിൽ ഹാരൂണും നിഷ നിജിലും. ഈ 2 വ്യക്തിത്വങ്ങളെയും മലയാളി സമൂഹത്തിന് ഒരിക്കൽ കൂടി അവതരിപ്പിക്കുന്നതിൽ ഞങ്ങൾക്ക് അതിയായ സന്തോഷമുണ്ട്. മറ്റൊരു നമ്മളോടൊപ്പമുള്ള വേറൊരു വിശിഷ്ടാതിഥി എന്നുള്ളത് പ്രിയപ്പെട്ട ലീന അലക്സ് ആറുകളാണ്. കമ്മ്യൂണിറ്റി ഒരു റൈറ്ററും കരിയർ കൺസൾട്ടൻ്റും ഒക്കെയായ ലീനയും നമ്മളോടൊപ്പം ഉണ്ട്. ധാരാളം നമ്മുടെ കമ്മിറ്റി മെമ്പേഴ്സ് ഓൾറെഡി ജോയിൻ ചെയ്തുകൊണ്ടിരിക്കുന്നു. എല്ലാവരെയും ഔദ്യോഗികമായി സ്വാഗതം ചെയ്യുന്നതിന് വേണ്ടി സമാജത്തിൻ്റെ പ്രിയപ്പെട്ട വൈസ് പ്രസിഡന്റ് ശ്രീ ഉമ്മൻ ജോസഫ് അവരെ ക്ഷണിച്ചുകൊള്ളും.
Thank you, Binu. My responsibility is today to welcome all of you for today's Dr. Live program. This is Brampton Malayali Samajam's 39th Dr. Live. So since we started the program, so this was a very good supporting program for the community. So all the programs that we are doing here is live on our Facebook, and also the archive is there, so anybody can go back and check. So this is a good support for the, I think this is a good way that we are supporting the community. We have today a doctor couple. I'm going to welcome all of you as my duty. Today we have a doctor couple to lead our Dr. Live program, Dr. Nigil Haroon and Dr. Nisha Nigil. Both are practicing doctors in Ontario. First of all, I would like to thank both of you for your dedicated service to the people of Ontario during this difficult pandemic time. Dr. Nigil Haroon, MD, PhD, DM, FRCPC, currently the Vice President of Canadian Rheumatology Association. Dr. Haroon is a rheumatologist at the University of Health Network and an Associate Professor of Medicine and Rheumatology at the University of Toronto. Dr. Haroon is a clinician scientist at the Toronto Western Hospital and the scientist in Canberra Research Institute. He is well published in his areas and he has been an invited speaker in several international meetings. Dr. Haroon has won several awards, including the Canadian Rheumatology Association Young Investigator Award and the Jane Bruckle Award of the Spondylitis Association of America. We all know about AKMG, Association of Kerala Medical Graduates. It's the premier and pioneer alumni organization in North America and the USA and Canada for the medical and dental specialist of Kerala origin. Dr. Haroon currently serving as organization's president-elect. AKMG Humanitarian Service is raising money to fight the COVID crisis in India, including Kerala. We as BMS is happy to be part of that humanitarian crisis event. Now I'll introduce, you don't need any introduction for Dr. Nigil, Dr. Nisha Nigil, because she's our own doctor in need, and she's a endocrinologist, researcher, and assistant professor of medicine in Northern Ontario School of Medicine. a board member of Canadian chapter of American Association of Clinical Endocrinologists. She is also very active in AKMG humanitarian service to support our own state, Kerala. She is with us in a couple of earlier events. She is always helping our Malayali community by posting the up-to-date information about the COVID-related in our social media. I'm happy to welcome both of you to our 39th Dr.Live program. Now I would like to introduce a special guest of our week, Mrs. Lena Mary Alex. She's a talent advisor, a motivational speaker, and a coach. She's also an author, now lives in Calgary, originally from Trivandrum. Recently, she's published a book, Overcome Your Interview Anxieties. I'm sure this book will help anyone who is preparing for any interview by getting practical tips to reduce interview jitters. I'm sure this book is available in Amazon and those who are interested can get it. I welcome Lena Mary Alex to today's Dr.Live program. Next, our president, Kurian Prakanam, doesn't need any introduction. He is everything of BMS and he is the guardian of Brampton Malayali Samajam. I welcome Kurian to today's Dr.Live program. I would like to welcome Binu Joshua as the chair of today's Dr.Live program. He is also a secretary of our organization. Welcome Binu to today's Dr.Live program. I also welcome all our technical staff, technical supporters who is doing the live program in Facebook and also coordinating the Zoom meetings. So welcome you all. And also I would like to welcome all who is watching in Facebook and other social media in this live event. I hope that this is the good live information that we are all helpful to live in this difficult time. Welcome you all to today's Dr.Live program.
Thank you. Thank you, Mr. Now, I invite Lena Alex to say a few words.
നമസ്കാരം, ഞാൻ ലീന ആലക്സ്, കാൽഗറി ആൽബർട്ടയിൽ നിന്ന് ജോയിൻ ചെയ്യുന്നു. ഞാനൊരു HR പ്രൊഫഷണൽ ആണ്. ഡോക്ടർ ലൈവിന്റെ 39ാമത്തെ ഇവന്റിലേക്ക് എന്നെ ക്ഷണിച്ച മിസ്റ്റർ കുര്യൻ പ്രകാണത്തിനും ബ്രാംപ്ടൺ മലയാളി സമാജത്തിനും ഞാൻ എൻ്റെ നന്ദി അറിയിച്ചുകൊള്ളുന്നു. ഞാൻ ഇന്ന് കൂടുതലും ഈ കഴിഞ്ഞ ആഴ്ച നമ്മൾ സെലിബ്രേറ്റ് ചെയ്ത ഇന്റർനാഷണൽ നഴ്സസ് ഡേനെ കുറിച്ചാണ് ഞാൻ സംസാരിക്കാൻ ആഗ്രഹിക്കുന്നത്. നമ്മുടെ ജീവിതത്തിലൊക്കെ ഒഴിച്ചുകൂടാനാകാത്ത ഒരു ഘടകമാണ് നഴ്സിംഗ് ആൻഡ് ഓഫ് കോഴ്സ് ഹെൽത്ത് കെയർ. നമ്മൾ ആലോചിക്കണം, ഒരു കുഞ്ഞ് ജനിച്ചു കഴിഞ്ഞാൽ പോലും ആ കുഞ്ഞിനെ കുളിപ്പിച്ച് ഒരു ബ്ലാങ്കറ്റിലൊക്കെ പൊതിഞ്ഞ് പേരൻസിന് മുന്നിലോട്ട് പ്രസന്റ് ചെയ്യുന്നത് പോലും ഒരു നേഴ്സ് ആയിരിക്കാം, അല്ലേ? അതുപോലെ തന്നെ ഇപ്പം വാക്സിൻ റോൾ ഔട്ട് നടക്കുന്നു. നമുക്കൊക്കെ വാക്സിൻ തരുന്നതും ഒരു നേഴ്സ് ആയിരിക്കാം. ഇപ്പോഴത്തെ നേഴ്സസിന്റെ ഒരു കോൺട്രിബ്യൂഷൻ ടു ഹെൽത്ത് കെയർ പറഞ്ഞറിയിക്കാൻ മേലാത്ത രീതിയിൽ ഇമ്പോർട്ടൻ്റ് ആണ്. May 12th ഇന്റർനാഷണൽ നഴ്സസ് ഡേ ആയിട്ട് ആദരിക്കുന്നു. നഴ്സസിനെ ആദരിക്കാനായിട്ട് ഈ ദിവസം മാറ്റിവെച്ചിരിക്കുകയാണ്. May 12th പ്രത്യേകത എന്താന്ന് പറഞ്ഞാൽ ഇത് ഫ്ലോറൻസ് നൈറ്റിംഗേലിന്റെ ബർത്ത് ആനിവേഴ്സറി ആണ്. ഫ്ലോറൻസ് നൈറ്റിംഗേൽ മോഡേൺ നഴ്സിംഗിന്റെ ഒരു ഫൗണ്ടർ ആയിട്ട് വേണമെങ്കിൽ പറയാം. ഷീസ് ഓൾസോ കോൾഡ് ദ ലേഡി വിത്ത് ദ ലാംപ്. അപ്പം ഈ ലോകമെമ്പാടുമുള്ള നഴ്സസിനെ ഞാൻ ഈ സമയത്ത് ഓർക്കുന്നു. ഒരു ദീപശിഖയായി പല പല രോഗികളെ ശുശ്രൂഷിക്കുന്നു. അവർ സ്വന്തം ഹെൽത്ത് പോലും മാറ്റിവെച്ച് ഒരുപാട് സാക്രിഫൈസസ് സഹിച്ചിട്ടാണ് അവർ ഈ ഫീൽഡിൽ ഫ്രണ്ട് ലൈൻ വർക്കേഴ്സ് ആയിട്ട് അവരിപ്പം നിൽക്കുന്നത്. അവരുടെ എല്ലാ കോൺട്രിബ്യൂഷൻസിനും ഞാനിപ്പോൾ നന്ദി പറയുന്നു. നമ്മൾ അവരോട് കടപ്പെട്ടിരിക്കുന്നു. അവരുടെ ഈ കോൺട്രിബ്യൂഷൻസിന് വേണ്ടി ഞാൻ നന്ദി പറയുന്നു. ഇവരെല്ലാവരും അമ്മമാരായിരിക്കാം, സഹോദരിമാരായിരിക്കാം, സഹോദരന്മാരായിരിക്കാം, അച്ഛന്മാരായിരിക്കാം. ഇവരെ എല്ലാവരും അവരവരുടെ ത്യാഗങ്ങൾ സഹിച്ചാണ് ഇവർ നമുക്ക് വേണ്ടി ഹെൽത്ത് കെയറിന് വേണ്ടി കോൺട്രിബ്യൂട്ട് ചെയ്യുന്നത്. സോ അവരെ എല്ലാം ഞാനിപ്പോൾ ഓർക്കുന്നു. അവർക്ക് എൻ്റെ ഭാവുകങ്ങൾ നേരുന്നു. അതോടൊപ്പം തന്നെ ഡോക്ടർ ലൈവ് പ്രോഗ്രാമിൽ നിന്ന് വന്നിരിക്കുന്ന Dr.Nigil and Dr. Nisha. I really appreciate your expert advice on this COVID situation. And again, ഈ പരിപാടി വഴി ഡോക്ടർ ലൈവ് പരിപാടി വഴി വളരെ റിലയബിൾ ഇൻഫർമേഷൻ മലയാളികളിലേക്ക് എത്തിച്ചു കൊടുക്കുന്നതിന് ഞാൻ നിങ്ങളോട് നന്ദി പറയുന്നു. ഡോക്ടർ ലൈവ് പ്രോഗ്രാം ഇപ്പോൾ 39ാമത്തെ ഇവന്റ് ആണ്. 40ഉം 50ഉം 100 പരിപാടികൾ പിന്നിടട്ടെ എന്ന് ഞാൻ ആശംസിച്ചുകൊള്ളുന്നു. താങ്ക് യു.
താങ്ക് യു ലീന. നമ്മുടെ എല്ലാം ഫാമിലിയിൽ ഒരാൾ അല്ലെങ്കിൽ ഒന്നിൽ കൂടുതൽ ആളുകൾ ഹെൽത്ത് കെയർ പ്രൊഫഷണലിൽ വർക്ക് ചെയ്യുന്നവരുണ്ട്, പ്രത്യേകിച്ച് നേഴ്സസ് നമ്മുടെ വീട്ടിലുണ്ട്. എല്ലാ നല്ല വർക്കുകൾക്കും നന്ദി ലീന. ഞാൻ അടുത്തായിട്ട് ഡോക്ടറിലേക്ക് കടക്കുകയാണ്. ഡോക്ടറെ പറ്റി പ്രിയപ്പെട്ട ഉമ്മച്ചായൻ വളരെ ഡീറ്റെയിൽ ആയിട്ട് സംസാരിച്ചു. ഡോക്ടർ നിജിൽ ഹാരൂൺ കമ്മ്യൂണിറ്റിയിൽ ചെയ്യുന്ന ഹെൽത്ത് പ്രവർത്തനങ്ങളുടെ ഒരു ഡീറ്റെയിൽ ഒരു റൈറ്റപ്പ് കഴിഞ്ഞ ദിവസം ബ്രാംപ്ടൺ ഗാർഡിയൻ ന്യൂസ് പേപ്പർ ഉണ്ടായിരുന്നു. ശ്രദ്ധിച്ചു കാണുന്നവർക്ക് അറിയാം. ധാരാളം ഇവിടുത്തെ അസോസിയേഷനുമായിട്ട് പ്രവർത്തിച്ചുകൊണ്ട് PPE കിറ്റ് അടക്കം കേരളത്തിലേക്ക് ഡയറക്റ്റ് കേരളത്തിലേക്ക് എക്യുപ്മെന്റ്സ് അയക്കുന്നതിലൊക്കെ വളരെ സജീവമായിട്ടുണ്ട്. അവരുടെ സംഘടന അതിന് നേതൃത്വം കൊടുക്കുന്നുണ്ട്. പ്രിയപ്പെട്ട നിജിൽ ഡോക്ടർ അതിനെപ്പറ്റി സംസാരിക്കും എന്ന് ഞാൻ വിചാരിക്കുകയാണ്. സമയം കളയുന്നില്ല. പ്രിയപ്പെട്ട പ്രസിഡന്റ് കുര്യൻ, എന്തെങ്കിലും 2 വാക്ക് ബിഫോർ ഡോക്ടർ?
എല്ലാവർക്കും നമസ്കാരം. എനിക്ക് ബിനുവും ഉമ്മൻ ജോസഫും ഒക്കെ കാര്യങ്ങളൊക്കെ പറഞ്ഞു, എല്ലാം ഇൻട്രൊഡ്യൂസ് ചെയ്തു. എനിക്ക് ഇനിയും പറയാനുള്ളത് പ്രധാനമായിട്ട് ഈ ആഴ്ച ഈദാണ്. എല്ലാ മലയാള സുഹൃത്തുക്കൾക്കും ഈദ് മുബാറക്ക്. അതുപോലെ തന്നെ ഇപ്പം ലീന ഓൾറെഡി പറഞ്ഞു കഴിഞ്ഞു, നമ്മുടെ നേഴ്സിംഗ് ഡേ ആണ്. അതുകൊണ്ട് ആതുര സേവന രംഗത്ത് ജോലി ചെയ്യുന്ന എല്ലാവർക്കും ബ്രാൻഡ് മലയാളി സമാജത്തിൻ്റെ ഹൃദയം നിറഞ്ഞ നേഴ്സിംഗ് ദിന ആശംസകളും ഈദിൻ്റെ ആശംസകളും ഈ അവസരത്തിൽ നേർന്നുകൊള്ളുന്നു. താങ്ക് യു.
Thank you, President Kurian. Now I invite Dr. Nigil Haroon and Nisha Nigil for today's presentation and speak.
Thank you, Binu. Thank you, Kurian. Thank you, Mr. Umman Joseph, and Alina as well. Great to see you. Nice to meet you. And maybe I need a consultation. You have got some talent. So some
consultant.
I'll need to take your advice on getting some.
Anytime.
Okay, it's great to be here. Nisha already had an experience with this, and she has been in constant contact with all the members, and through other channels I've also been in contact with a lot of the Malayali folks here, and it's always a pleasure to come back and hopefully, you know, whatever we can give back to the community and hopefully lead this effort. For today's program, what we were thinking, we're coming together, the 2 of us coming together, what the main idea was to hopefully answer any questions that you may have, try to address as much as we can any of the issues around, for example, the current surge in cases, the vaccine efficacy, recent developments in Ontario, recent developments in India and Kerala, what the situation in Kerala is currently, what the situation in Ontario is currently. Some of these areas which we were hoping that we can answer if you have any questions. But before all of that, maybe each of us can give a little bit of fun, maybe a 5-minute talk on what's happening, what we have in mind. As Binu pointed out, I think first and foremost in my mind currently is the work that we are doing together with Brampton Malayali Samajam. A number of other organizations are involved. So I don't want to miss anybody's name. So let me.
Can you screen share that one, Sanjay, the flyer?
Yeah, I think that'll be great if you can do that.
Okay, I'll do that.
Yeah.
Yeah, just give me 2 minutes. Thank you.
Yeah, sure. Like I have the flyer now. Anyway, so the idea around this project was that as you've seen these images coming out of in India, from India, especially the northern part of the country. It's quite heart-wrenching and tragic what's happening. And we can come up with many reasons why this has happened. And is it the variants? Is it the change that has happened in the virus that has caused this? Or is it something else? I would tend to believe that, you know, the biggest factor that affects spread of virus in any country is human behavior. And one of the factors that affects the spread, apart from just the human behavior, is the limitation in which we have in controlling human behavior. And the primary reason, of course, is population and population density. So India is a country of a lot of people. The population is significantly higher than many other countries in the world. So there are some limitations related to that. The other factor is difficulty in communicating with the masses and conveying the importance of physical separation, conveying the importance of protecting ourselves from the virus because of the significant potential adverse effects and even life-threatening events that can happen in the future. It is not easy. It is not easy in a big country like India. And on top of that, you know, we have had elections and multiple festivals, and again, in a large country, it's difficult to convey the important messages. So what we thought is that this thing started in the north, and it was in a situation where we were not sure if we can meaningfully intervene at that time and make a difference. So we thought we had a lot of discussion around what is best that we can do, and we thought that being preventative or preventive is much better than trying to go into a situation where we may have minimal impact. The resources are minimal. And so that's why we decided to concentrate on a place where the things are getting worse, but have not yet peaked. And also, you know, our heart lies in Kerala. Another reason is not just that it was just going to peak. The other reason is that we need direct contact with people on the ground to make a difference. We can just send money and then sit back and hope that there is good use that comes out of the money, or you can actively participate and make sure that there is good use out of it. So we decided to actively participate. And we cannot actively participate just by sitting here. We need to have reliable people on the ground. And we had that in Kerala. And that's the second reason why we thought, okay, we should concentrate our efforts in Kerala. So this flyer is there. What we did as AKMG, it's roughly 4 weeks ago that we decided to launch this program. It's a we called it COVID-19 crisis relief. And we started off with significant donations from our members within the organization. And a number of organizations outside AKMG approached us, seeing the success of our program and fundraising and how it is progressing. So we were very happy to welcome anybody who wanted to work with us and who wanted to contribute to this cause. So we have a big list of organizations. It's much bigger than the flyer that is up here on the screen. I don't know if I can share the screen. Let me see if I'm able to. No, it's not. Yeah, I think I can share the screen. I've got a bigger flyer here, which is more. Can you see this? Yeah. So if you look at these associations, you can see, you know, Brampton Malayali Samajam is prominent there, and many other organizations like Mississauga Kerala Association, the North American Network of Malayali Muslim Association, the Cochin Club, last Monday, Kerala Islamic Association, British Columbia, Durham Malayalian Arts and Sports Club, Halton Malayali Association, London Ontario Malayali Association. We have our radio partner, AHA, photo and video partner, SLR, and media partner, News Digest, Enda Canada, that's the social media partner. Apart from these organizations, so we have Kansas Malayali Association that has joined us recently. So yesterday I got a call from a group called Manka. So that's the Malayali Association of Northern California. They want to join us. And there is another one also around California that wanted to join us. So it's become a really big, massive North American movement of multiple organizations. And it is a great cause, and that has brought all of us together. And I think we should come together even in the future for all such important causes, because together we can make a big difference. Now, with that introduction, I would like to say what we are trying to do in Kerala. So we have seen, and yesterday as well, we got an update on the situation in Kerala. The number of cases have significantly increased. So you may not be realizing it because it is not yet on the surface yet. It is just like that iceberg where there's a huge burden below and it has not become evident yet. But if you ask people, they are finding it extremely difficult to get beds, even in major institutions which are multi-bedded. So you can imagine the situation in the smaller villages and city and the smaller towns where the size of the hospitals and facilities are much, much smaller. So we are there right at the brink of a major issue coming up in Kerala. And thanks to the lockdown, the double lockdown, the triple lockdown, whatever you want to call it, thanks to the lockdown, there has been a significant decrease in the rate at which it has been increasing, but still we are not out of the woods yet. So we thought that, rather than trying to react emotionally and try to send in like oxygen supply and things like that, which may be helping maybe only 1 or 2% of the people, or may not even help. By the time our stuff reaches there, maybe the requirement for acute care is no longer there. We thought we should concentrate our efforts on where you can really make a much bigger impact. And that is by preventing the infections. That is number one. Now, preventing the infections can happen with major two initiatives. One is education, and second one is providing ample supplies to the places that require protection. And on the surface, again, you may be getting the news that there is no significant requirement for masks, but actually under the surface, there is a big requirement for high quality masks. High quality masks are essential for preventing the spread of infections. And these need to be not just at the healthcare worker level, but also at the community worker level, like ASHA workers and the other workers who are really interacting with the people. So we have developed this program to supply masks to multiple levels of healthcare workers throughout Kerala. For education, the Indian Medical Association, whom we are partnering with, they already have a network of 1,000 small and medium-sized clinics throughout Kerala. And they have an education program which is already underway. So we have an existing network which we are utilizing. We don't have to reinvent the wheel. So already we are set for success. So that's the importance and beauty of our project. Regarding procuring masks, we are talking to companies. And just yesterday, we got information, very good news, that we may be able to procure a huge supply of masks, like a quantity that is, which is probably higher than any other shipment that has gone to India so far. So it's a large number. I don't want to give you the number yet, but before we have the final contracts in place. But this is a big donation from a major company in Canada, and we are grateful to the company who was donated this. Global Medic is behind this, and Global Medic are our logistic partners. They are the people who are donating this from the bigger company to our organization. The second major project that we wanted to do is tackling the issue of hospital beds. Okay, so hospital beds are really required for the most severe patients with COVID. As you all know, the vast majority of people have mild COVID symptoms. They may not even they may not even realize they have COVID. For the next level of symptoms, they may have just like upper respiratory infection and common cold, maybe a cough, maybe loss of smell. Okay, they don't really need a significant treatment. The next level would be the people where the oxygen saturation dips a little bit. So your lung gets affected, and that's when the atmospheric oxygen cannot get in through the lung into the circulation. So when there is a small amount of the lung that gets affected, this oxygen exchange gets affected, you don't get enough oxygen. You can monitor that using a very simple device, the pulse oximeter, as we all know now around the world. Normally we would expect oxygen saturation to be between 95% and 100%, right? And when our lungs get affected, start getting affected in the early stages, it may not be changing a lot. But when it starts dipping below 94%, 92%, then you have to be on guard, because the things may rapidly deteriorate and it may spread to the rest of the lung, and the oxygen saturation may significantly decrease. So at that cusp, before the deterioration, there are a lot of individuals who need very close monitoring and who need oxygen support as well, who may, some of the individuals don't need oxygen monitoring, they may need some medications. So a lot of these individuals are currently being managed in the critical care beds in the hospital. And when all of these individuals, which is a large number, occupy these beds, the small number of individuals who really need the critical care beds are not able to get into the hospital. And that's where the mortality happens. Because all these beds are being used by people who can be managed elsewhere, alternative form of treatment. So that is where we are trying to implement the domiciliary care program. And that's something which is very important for Ontario as well. Fortunately, because of this long period of lockdown, the ICUs are not at their peak right now. But if you had asked me 2 weeks ago at our hospital in University Health Network, we were really sweating. And a lot of, we started off with one COVID unit, COVID number 1, COVID number 2, COVID number 3, and we were at almost starting COVID number 14 by the time the lockdown came in, and then things started going down, right? So the ICUs were almost at 90, 95% capacity before it started going down. So imagine if it had crossed the 100% capacity, we would have the same issue here. So it is important to realize the importance of domiciliary care. And first of all, people need to know that only domiciliary care is needed. Second one, they need to be sure that if they need help, they have access to help. Third thing is they need to be safely monitored at home. So all the three factors are extremely important for domiciliary care program. So for the first purpose, for the domiciliary care program education, all these networks that we have in Kerala, they're educating the people about what is needed when you really need to, at what stage do you really need to go to the hospital. The second one, for connection with the hospital, we're building a network so each person who is registered for domiciliary care program is connected to one healthcare worker. They can easily reach the healthcare worker either for continuous monitoring or for help to transfer to a hospital. And the third thing is safely monitoring, and that's where the pulse oximeter supply comes in, and that's where we are supplying the pulse oximeters. So this essentially is the program that we're trying to develop there. And this is equally applicable to any country which is facing the same situation. I just wanted to give you a brief idea of what's happening here. And I'll probably stop there. Maybe Nisha can talk a little bit, and then we can take questions.
Doctor, if you can turn off your screen sharing.
Yeah, I'm just trying to see where it is. Okay, yeah. Good.
Thank you, Dr. Nigil. I hope Nisha is taking over.
Yeah, thank you everybody for joining and helping us to spread the right information, and also to create awareness about the fundraising campaign aimed at helping our people back home in Kerala. So I just have a little update on the Canadian situation. So we are on a really good trajectory. Things look very, very optimistic. Mostly the last month's lockdown seems to have worked, but more importantly, our vaccination drives were boosted exponentially in the last 6 weeks or so. And this is definitely paying off. We are starting to see decline in the actual numbers. So we should all roll up our sleeves and get our youngsters vaccinated. Now they're rolling out vaccinations to 18-year-old as well in hotspots, and also in other non-hotspot areas, 40 plus. We have a large containment and supply chain opened up for mRNA vaccines. So on that regard, I just have to thank everybody who went ahead and took the AstraZeneca vaccine, especially those in the hotspots. That has also made a big difference. The situation has changed significantly compared to what it was 6 weeks ago. So we now have more mRNA vaccines. So now they're going to temporarily phase off the delivery of Astra vaccines. There are several reasons. Main reason is that now we have more mRNA vaccines with slightly better efficacy and slightly better safety profile than the AstraZeneca vaccine. So this is the message you can convey to our people. Those of you who took the AstraZeneca vaccine, there's nothing to worry. We just have to monitor some symptoms for 4 to 6 weeks after you've given the vaccine. So that's one message I've been trying to spread across our groups, just to, there are certain things that you have to watch for. For example, persistent and severe headache, any muscle weakness, or inability to move your hand, inability to move your finger, or any muscle weakness, any facial changes, convulsions or fits, any blurring of vision, or breathing problem, chest pain, stomach pain, or any swelling or redness in your leg, or a cold sensation in your leg or hands. So those are symptoms to watch for. And again, these are extremely rare neurological side effects, or some side effects related to blood clots in the body. Again, 1 in 250,000, and in certain subgroups, probably 1 in 30,000 or so. So if you have any of those concerns, usually these things happen between 4 and 20 days after vaccination. So immediately contact your family doctor and they will initiate the workup. And again, extremely rare side effects. So I'm just updating you, that's all, just to spread the awareness. And most of us are waiting for a second dose. Again, be confident that the first dose is really good, and we do have evolving data that the first dose itself is giving us robust protection for up to 3 months. In fact, that is being considered as a better strategy rather than giving 2 doses. And I think if our NACI, the Canadian Immunization Council, made a bold decision 2 months ago and pushed for vaccinating more people with 1 dose rather than giving 2 doses to a limited number of people. And I think that decision has definitely paid off. Even as a healthcare worker who is working frontline, I've only received 1 dose of the Pfizer vaccine, but I was extremely confident with our government's decision to go ahead with 1 dose. I think that is paying off. So probably most of us will be getting our second dose soon. So I would like to conclude with a very optimistic note that Canada is doing extremely well. Yes, we have identified the B1617 variant from India in Ontario, BC, and certain other provinces. But luckily, these variants, thanks to the behavioral interventions and social distancing and continued masking and other strict public health measures, we will be able to even cut down on the spread of the new variants as well in Canada. And the vaccines also, according to lab neutralization studies, the vaccines have also been found to be effective against these variants. So we need to just have confidence in our healthcare system, in our public health officials, and don't fall prey to misinformation. You will find millions of posts being spread across WhatsApp groups, especially from India, spreading lots of misinformation. Even as of this morning, I've had to sit and read through these misinformation posts. It's very sad. We have to have faith in science, faith in scientific organizations. We're all trying our best. Yes, the recommendations have changed, but more and more evidence and more confirmatory evidence that most of the scientific evidences and guidelines have been correct. So yeah, that's all from me today. Thank you everybody for logging in, and let's continue to spread the message and continue to support Kerala and India in whatever way we can.
Doctor, there is a question in the chat room, if you could read.
Yeah,
Is it for me or Dr. Nigil? Yeah.
It's the question.
So I can answer that question. So what's going to happen is now they are looking at, so what happened was Pfizer company, I haven't read any confirmatory information on this, but Pfizer company had this deal that, they based on the contract, whoever got the first dose of Pfizer, it is the company obligation to give them the second dose. So that kind of paid off. Let's say we vaccinated 300,000 with Pfizer vaccine. So we will fulfill that contract obligation from Pfizer. So those of who who received Astra vaccine, there are now studies looking at giving them Pfizer as a second dose or a Moderna mRNA vaccine as a second dose. So we will get more information. Probably that will also work, or they will get the second dose of Astra. So that's on the work. Yeah. So another question from Lena, I can take that. Thank you for that speech, Lena. You did a great job. So our aim is to vaccinate at least 2/3 of the population with 1 dose by end of May, and 2/3 of the population with 2 doses by September. So that 1 dose itself will get us very close to herd immunity, at least short term. So, and then we do have surplus supplies coming in. There was this temporary issue with the Johnson & Johnson vaccine, so that is being sorted out with more mRNA vaccines. And I think by November, Canada is also looking at making our own vaccine and also boosting up our own local vaccine protection. So I don't anticipate any big problems as far as Canadian herd immunity is concerned.
I think 1 dose has been given to at least 1/3 of population in Canada, but fully vaccinated, the last time I checked was around 10% or less, right? So fully vaccinated, it was much less than that. But at least 1 dose, because the drive was on giving at least partial protection, it has been at least 1/3. But that is going to significantly change in the coming 1 or 2 months because of the large number of supply that's coming in. And for the AstraZeneca, for now, what the order has come is that AstraZeneca is not being planned to be given as the first, or is not being recommended as the first injection. So, but it is still available, and the recommendation is to take the same one as a second dose for those who have received it as the first dose, as long as they didn't have a bad reaction to it or major issues to it. So I don't think there is any problem there in taking it as the second dose. Yeah. Okay, so that's done. That's done. What's
I think Lena has a question about school reopening. One of the biggest breakthrough that happened is that I think almost all teachers are now vaccinated, whoever was willing to get vaccinated. So that would make a big difference. And I think they're also working on improving the ventilation systems and all that in the public school system. And another breakthrough that we're going to see by fall is that Pfizer now has received FDA approval to vaccinate kids older than 12 years. So the 12 to 15 age group, as soon as we get them vaccinated, probably, yeah, we are looking at schools getting vaccinated. I think there'll be full opening in fall. Looks optimistic.
So for schools also, I've always felt that the transmission in schools is directly related to the level of community transmission. So if there is a lot of transmission in the community around the school area, you can expect that to happen within the school as well. The second point that we also need to consider is the relative efficiency of transmission of the virus relatively in the different age groups. There was a thought that the variations have caused it to spread into the younger ages compared to the older ages and cause disease there. I'm not too sure if that is completely true, because we are vaccinating a lot of people in the elderly age group. Naturally, the virus finds its host, which is susceptible, and that will be in a much younger age group. So that's another thing to be considered. With all of these advances, and as long as we don't have significant community transmission, the schools can open safely, in my opinion. There was a question on the second dose timeline for vaccines. As of now, for the general public, still the recommendation is to keep the longer gap between the doses, because first of all, there is protection, partial protection from the first dose. Second point is that it doesn't impact the results of the vaccine, even if you delay it by 3 months or up to 4 months. And in fact, in some of the studies, it has been even shown that some of the individuals who have received the vaccine a little later than the initial few weeks may in fact have a slightly better immune response. So because of these reasons, for the general population, there is no rush to really decrease the gap. We can do that if we have enough vaccines. But till that time, I don't think there is any rush. But there are exceptions there. Primarily, it is for those individuals who have a condition that affects their immune system, or they have a condition that increases the chance of significant complications, or they're taking medications that also suppress their immune system. For now, the individuals who are taking immunosuppressants, they've been shown to have less efficacy to the first dose alone. So there is a recommendation that the second dose should not be delayed so that they are better protected. In practice, on the ground, what has been implemented is primarily for individuals with cancers and those who are taking cancer medications. That was the first step. A lot of organizations, including, for example, the Rheumatology Association, the inflammatory bowel disease community, the gastroenterology community, a lot of these communities have come forward and said that, look, these individuals are also taking medications, strong immunosuppressants, and they also need to be brought under this shortened gap vaccination. So that's still in the works, and except for these small populations, well, I wouldn't say small populations, but these important categories where delay is not optimal. For now, for the rest of the population, I think it's still continuing the same. It may change with the vaccines. Yeah. I don't see any other questions.
Just one more question.
I have a question. Sorry. Okay, go ahead, Jitin.
Yeah, just one question. Hi, doctor. My name is Jitin. So my question is, with the different variants coming, there is always this concern that we will be behind because the variants might not be prevented, or the vaccines cannot probably work against the variants. Probably whatever we have found so far, there's no concrete evidence, or there's no study, or there's nothing that gives general public confidence that against the variants the vaccine works, and then there can be future variants as well. So that wherever I read in the newspaper, and a lot of people that I talk to, whoever has this vaccine hesitancy keeps commenting that, but what is the proof that this will work? So I know when we go with something better than nothing, it's better to get vaccinated. But just wanted to hear your opinion and your understanding about the same.
So Jitin, I would say that, that is a concern for any infection, right? It's not just for COVID. For any infection, especially a viral infection that is prone for mutations to develop, it's always a concern. But the thing we have to, first of all, there is data, and then there is the theoretical explanation behind this. So data-wise, so far the vaccines have been shown to be effective against all variants, right? So far we have that data. The second thing is the variants. The major concern currently is for the variants that are being transmitted in India. The predominant one, the B1.617. So that is a major variant. It has two mutations that have been identified in other areas. For example, there is a California variant, the variant which has been around in California with increased transmission. So that common mutation is also there in B1.617. And then there is the P1 variant, and also the variant, which is prominent in Brazil, another one which is prominent in South Africa. Both of them have changes within the area where the antibodies bind. So there is a decreased efficacy of the antibody binding to that particular area. So we may think that our immune system, either from natural infection or from vaccinations, may have a slightly lower response to this area. But this is only the antibody. So how antibodies work is, antibodies look at the big picture and the structure of the protein, right? And they bind to the structure. For example, it detects a ball different from a square. It detects a square different from a triangle, right? So if there is a particular structure of the virus, the antibody binds to that structure. So not just the sequence, the small variation, but also the structure is important. And that is why maybe the antibody is not binding well there. But we have a big second system for protection in our body called the cell-mediated immune system. So how the cell-mediated immune system works is this ball or triangle or a square, in whichever form it comes, our cells break it down into small pieces. Just imagine a Lego piece, a small brick, with which you can build a ball or a square or a rectangle. The antibody detects it only in the form which it has seen it before. But our cell-mediated immune system recognizes each block, each Lego block. So even if there is a very small variation in somewhere, even the secondary structure changes, our cell-mediated immune system is capable of detecting each small part of the virus. So there is no evidence so far that cell-mediated immune system is affected by any of these significant variations to an extent that it will affect our vaccine efficacy, right? So I don't think we have to be worried about it. What is most important is vaccinate it as soon as possible, get rid of the virus before giving it a chance to mutate. Why give it a chance to mutate by vaccine hesitancy? You know, so if we act in advance, we will overcome. That's the message which I want to give. Yeah.
This was really comforting. Thank you.
Yeah, so the media has always been coming out with clickbait headlines, spreading this misinformation that these variants may not be amenable to vaccines and all that. That's absolutely not true. Scientific community and worldwide, like even in India, scientists are working in their labs, looking at neutralization studies against all these variants. And so far, we haven't found any signal. Yes, there have been breakthrough infections in people who have received even 2 doses of vaccine, but that is like a multivariable thing. There are other factors we don't know. Even doctors have succumbed after getting vaccine, have succumbed, and we personally know people who are on ventilator after having received 2 doses of the vaccine. But that's on a different scale. You know, these are people with other comorbid conditions, or the timing of the vaccination and the exposure and their immune suppression and, you know, exposure setting. There are multiple factors predicting these things. So it is not like, you know, that doesn't mean that the vaccines don't work against variants. Otherwise, you know, you would have seen hundreds of healthcare workers dying by now. So there is evidence, there is really good evidence supporting the use of vaccines and continued use of vaccines. So don't fall for these WhatsApp forwards and clickbait headlines by TV channels and media. They're just there for their TRP ratings. So that's been a sad reality, though.
I would like to just qualify that statement. You know, we know of 1 or 2 doctors who have had issues, and there are hundreds of thousands of individuals who have taken vaccines with no problem. Right?
Yeah, absolutely.
Thank you. Thank you so much.
Any other questions from floor?
Hi, this is Vinay. Can I ask a question?
Hi, Vinay.
Hey, I'm VK as well. I already asked 2 questions, so this is my 3rd and potentially a 4th. So sorry. I'm so thankful to BMS and the doctors here for this session. Extremely useful. My kids have been listening to. Very relevant. And like you said, instead of looking at WhatsApp forwards and fake news, right? This is very dependable for us. So thank you very much for that. I had 2 more questions. First is, look, whilst the mortality numbers in Kerala is about 4K now, 4,000 plus maybe, is there any correlation or statistics available at this stage of how many of those had potentially 1 or 2 doses of vaccine, and not just in Kerala, anywhere in India, for example? And what is the percentage of people without any comorbidities who had vaccines but still, you know, faced a complication, right? And related, I also read in dependable forums that this virus creates some issues within the organs, like heart, lungs, or whatever. So even if that recedes and you're declared COVID negative, so to speak, you are still vulnerable in the following 3 to 4 months to any sort of organ failure or further complications that may be a secondary or tertiary impact, right? Those are two questions in that one question. Last is with respect to US and the UK. Now, I lived in the UK. I moved here from the UK. I have lots of friends and family there. Not family, more friends. But UK is completely easing on the May 26th, right? They are already almost, fully relaxed. They have a big date coming up on the 26th of May. Now, is UK, like countries like UK, being the leader in setting global trends, getting ahead of themselves and calling this a complete ease based on what they're seeing in UK? And also we have President Biden, who advised yesterday that, you know, indoors, inside buildings and houses, they don't need to wear masks anymore. So I personally believe these are a bit premature. This kind of decision making is making things complicated for many other countries who look up to these countries. So these are my 2 or 3 questions. So statistics, organ failures and further impact, tertiary, secondary impact, and then this easing in leading countries. Thank you.
Maybe I can start with the last question and then Nisha can take the others. For the reason why initially we were not coming forward, people have been talking about this is mixed messaging, and that is spreading vaccine hesitancy. Why should a vaccinated person still be wearing a mask? So you're not being protected, so don't take it at all. So that there was an issue of mixed messaging initially. However, we have to put things in context. We don't go by, we don't make policies in a pandemic situation just based on hypothesis and expectations. We have to strictly make policies based on evidence. Initially, because we were just starting to vaccinate people, there was a theoretical possibility that even if you're vaccinated, we don't know the level of protection against a virus, being in the upper respiratory tract, even in a vaccinated individual. And so if you're near somebody who is not vaccinated, and if you sneeze, there is a potential that maybe an amount of virus that is staying there, although it is not affecting you personally, may be transmitted to the next person. That is a theoretical possibility. The other obvious reason is that even if you are vaccinated, there is nothing stopping you from touching a surface which has a virus and then shaking hands with somebody else and transmitting the virus. So there are several issues to this. With these possibilities and a raging pandemic, why take a risk based on the possibility that you're completely protected? Now, what has changed now is vaccinations are significantly increased. So a large proportion of the population is protected. That's one thing. Second thing is now we have data that vaccinated individuals, even if they carry virus, it's in minuscule amounts, and that is not large enough to replicate and transmit to other individuals. Okay. So now we have that data. And the third thing is, the transmission via fomites, it is not a major form of transmission for COVID, for the COVID virus and SARS-CoV-2 infection. Based on all of this evidence, now we can scientifically make and objectively make a recommendation that you don't need to do it, provided both parties are vaccinated and then both are protected. So that is the reason why it has taken this time. Now, we could have jumped to this conclusion initially, but if it was a mistake, we would have not been able to control this pandemic. So that's the reason there. Nisha, do you want to take the next one? Yeah.
So, I mean, the part of this is also determined by the level of system preparedness and level of system capacity, right? UK probably being, they have universal healthcare and a centralized system of healthcare delivery like we do, probably maybe more per capita bed. So there are a lot of other variables. So probably they have confidence in their healthcare system performance. And now that the elderly are vaccinated, right, the seniors, what we saw, the big surge in healthcare utilization was because of the very frail seniors getting affected and dying. That's the same thing that happened in Canada too. So there are other factors to determining, and we can't continue to do lockdown forever, right? We have to have, in terms of mental health and other physical activity. There are several other pandemics brewing in the background. So there's a mental health pandemic, and then metabolic diseases like diabetes and a lot of things. We're going to see a tsunami of those issues. So it has to be a fair balance. So I think, USA too, perhaps they're more prepared in terms of healthcare capacity and all that. So that should be, I do trust the CDC judgments now. And coming to the data on breakthrough, we call it breakthrough infection. So, well, if people develop infection or complication after getting vaccinated, it's called a breakthrough infection. So that data from India, ICMR did publish some data, but it's not complete. We're still waiting for more clarity. But then the healthcare system is now going through like tremendous devastation. So this is not a time to expect a good amount of that sort of data from India. They're going through, the priorities are clearly different. And same thing in Kerala. Also, doctors and other public health experts are collecting this data real time, and there are a lot of ongoing efforts. So we'll get to see it probably in a couple of months or so. We'll start to see publications coming out of India, but many are working. But the problem is, even pathologists and even non-MD doctors or even public health doctors are now being asked to work in COVID wards. So nobody has the time, unfortunately, to focus on this right now.
So for the second question out of those three, I think, is on long COVID. Long COVID is a major issue. No, that is why a lot of people are saying that COVID is unlike many of the other viral infections that we have seen. A lot of individuals who have had significant involvement of the lungs go on to have persistent cough, sometimes shortness of breath, and some may even require oxygen for a little bit of time. We still are not clear what the long-term picture looks like. We don't know if there is is this going to last 6 months, it's going to last a year. I suspect that for those who have had significant involvement of the lung, this may last a long time, because it is, if once the lungs are fibrotic, it is very difficult for it to return to normal. Fortunately, we have a big reserve capacity. So the large number of individuals who have only a small part of the lung affected will still manage fine. It's only those individuals who have had significant issues that's going to be lasting longer. There is a correlation with the severity of symptoms and the comorbidities, right? The more severe disease that you've had when you were sick, the higher the chance of greater damage to the lungs and other organs in the future. So things to consider, other than just a simple viral infection, always keep in mind that this could end up being something that stays for a long period of time, affecting your lives. So yet another reason to get vaccinated. That's really the message. Regarding management, once the virus is cleared, whatever is left behind will be managed just like any other chronic disease. If there is a lung issue, it will be managed like a chronic lung disease. It will not be managed like a viral infection at that time. Cardiac issues can come. It will be managed like a cardiac issue, not like a viral infection at that time.
I can add, since Jitin brought up the issue of vaccine hesitancy, I think a lot of us are involved in clearing vaccine misinformation, and those one-on-one sessions, even with your friends, continue to engage your friends who have vaccine efficacy, the vaccine hesitancy. These conversations, person-to-person conversations are definitely helpful. And in the US, they were faced with tremendous, high levels of vaccine hesitancy, but they have made really good progress. People will change their mind, but there'll be probably 5 to 10% of people who will not get the vaccine, who will not take the vaccine, even if they see their family members around them dying. So we will not be able to change those people, but there are a lot of other people who will change their opinion. Don't be discouraged by that. It is difficult to convince them, so let's not focus on that population. And if you look at the data from New York, probably there's some confirmation that around 6 million New Yorkers who got their smallpox vaccine in 1947. In a month, they were able to vaccinate 6 million people, and that was in 1947. So last month, I think in the last 6 months, they were able to vaccinate 175 million Americans. So they have made tremendous progress. That's more than half of their population. So we'll get there. I think we are on the right track.
Apologies, I have the other meeting. Kurian, you know the other meeting, right, with the Indian Medical Association. It has already started, so I have to leave.
Thank you.
Thank you. Thank you very much.
Thank you, Dr. Nigil. Thank you. Thank you for your valuable time.
Thank you, Doctor. Thank you.
Yeah. Okay. Thank you.
I have one quick question before we leave. I'm sensitive of the time as well. So, Dr. Nisha, I'm not in the medical field, and I'm quite concerned about what's happening in India. As a person not in the medical field, what can I do? 1 or 2 things that I can do to be of help and be of use to people back in India?
Is that Lena? Sorry, the video was a bit frozen.
Sorry, this is Lena. So I was wondering, as a non-medical person, what can I do?
So I think we all can play a part, because I think most of us who are even non-MDs are as educated as MDs about this pandemic. And one of the biggest limitation that we have to accept is that there is no magic remedy for this disease. It's a viral disease. You can throw in any number of medications you want, remdesivir, even other like plasma, none of it works. Remdesivir also will work in select people, right? So what we have to admit or acknowledge is that this is a viral disease. There is no magic cure. So all the treatment we do are supportive, and we are also learning as we see more data. So and still 95% of the people have 100% recovery. So we have to continue engaging our family members, or even through WhatsApp communities, especially people like Lena who are motivational speakers. That is what I'm requesting, gain confidence and give them emotional support. That makes a big difference. And also try to clarify misinformation. So, this milk and turmeric and lemon juice or steam inhalation might not work. You have to have faith in science, and you have to have faith in public health measures. I think one of the biggest reasons for the virus spreading in India is small gatherings. You can blame any number of politicians, any number of governments for their failure, or you can continue the blame game. But actually, the small gatherings have contributed a big deal. There has been failures at different levels, but public also have played a role. So continue to spread away. With all religious festivals, we see small gatherings happening. I mean, across all religions, unfortunately. So you have to continue. And this is a preventable disease, right? So we see that in Canada. We've been locked down since March, to be honest. We never had we haven't seen our friends or family in a year, right? None of us, we can vouch for that. So share our experience with people in Kerala. So this is normal. You have to be patient. Probably another 6 months, we'll get back to normal. So Kerala, in fact, is even trying to develop their own vaccine manufacturing plan. Tremendous amount of relief measures are being taken up, and we have to continue fundraising and spread the positive message in the sense that we need public participation. Kindly avoid small gatherings. That is the biggest message we can continue to remind our people. Even my own friends who are doctors, we have hundreds of physician friends in the US, even they are finding it difficult to convince their parents back home to avoid these small gatherings, or to, they are so used to, meeting people on a regular basis. So you just walk into anybody's house, right, back home. So that's normal. Yes, and with the internet and all that, emotional support, and we can continue to be connected with everybody. So we need motivational speakers like you, Lina. You can do a much better job than us doctors, because as such, the faith in healthcare system is not great. So people like you should be at the forefront.
Thank you, Dr. Nisha.
Just one more question. So DRDO has developed a 2DG medicine, something which can prevent. So anything that you can share about that?
Again, I mean, right from the beginning, right, in March onward, we've been seeing a lot of medications being, this is we call it a kitchen sink approach. We're throwing everything. We started with hydroxychloroquine, and then it was ivermectin. We've been throwing even HIV medication, malarial drugs, antiviral, other influenza medication, even antibiotics for a viral disease, and Ayurvedic medications, homeopathy. Now we know none of this works, right? And the DRDO medication was based on a small study again, but desperate times, and they are trying everything possible. So I don't want to dismiss their scientific credentials. We don't know. I'm not in a position to comment for or against it. Hopefully, there have been small scale phase 3 studies, but without large scale trials, it is difficult to say. And even interestingly, today I got a WhatsApp forward in my MBBS batchmate WhatsApp group saying that there was a newspaper headline which said even people who received fake remdesivir had a good recovery. Mm-hmm. So that means even without any medication, people do recover. We just have to make sure that the hospitals are not overflowed. That is what is happening in Canada. We are able to maintain or prevent a system collapse, or able to give oxygen to everybody because we have enough hospital beds. We've stopped doing our surgeries. We've stopped doing our routine care. All we do is COVID now, right? So barely we are managing the system capacity. So once that is what we need to do. Let's not focus on medications. Unfortunately, these medications are giving a false sense of protection, and security. Medications do not work for the most part, except the steroid. The same group that from United Kingdom who published the steroid data that in specific population, that's not in everybody though, even the steroid, the same group has come up with a new publication today looking at 12,000 people saying that convalescent plasma doesn't work. So in the US alone, 5 lakhs of people have received convalescent plasma as treatment.
Okay.
So today we get this trial that it doesn't work. So at least we now know that it doesn't work, right? So at least we are wasting a lot of money and resources, arranging fund, arranging donors. A lot of this energy is being wasted on treatments that don't work. That is a biggest concern. And the DRDO medicine, I hope it works. And we probably, now that the pandemic is raging, so we might get clinical trial data soon. We need data. Without data, we will be a big failure.
Okay.
Thank you. Thank you, Doctor, for patiently answering all the queries from the team. നേരത്തെ ഞാൻ സൂചിപ്പിച്ച പോലെ ഈ നമ്മളെ സോഷ്യൽ മീഡിയയിലും മറ്റ് മീഡിയയിലും ഒക്കെ കിട്ടുന്ന ഇൻഫർമേഷനേക്കാൾക്ക് വളരെ അതോറിറ്റീവായിട്ടുള്ള കാര്യങ്ങളാണ് നമുക്ക് ഡോക്ടേഴ്സിൻ്റെ അടുത്ത് ഈ ഫീൽഡിൽ എക്സ്പേർട്ട് ആയിട്ടുള്ള നമുക്ക് ഏറ്റവും അവൈലബിൾ ആയിട്ടുള്ള എക്സ്പേർട്ടാണ് ഇപ്പം നമുക്ക് കിട്ടിയിരിക്കുന്ന രണ്ടുപേരും. വളരെ നല്ല ഇൻഫർമേഷൻ കമ്മ്യൂണിറ്റിക്കും നമ്മുടെ സമാജത്തിന് എല്ലാവർക്കും നൽകിയ ഡോക്ടേഴ്സിനുള്ള നന്ദി, സമാജത്തിന് വേണ്ടി അതിനെ അഭിനന്ദനം അറിയിക്കുകയാണ്, നന്ദി അറിയിക്കുകയാണ്. അതോടൊപ്പം തന്നെ ഡോക്ടർ നിഖില് സൂചിപ്പിച്ച കാര്യം കമ്മ്യൂണിറ്റി ആസ് എ കമ്മ്യൂണിറ്റി വാട്ട് വി ക്യാൻ ഡു ഫോർ ദിസ് പാൻഡമിക് എന്ന നിഖിലും ടീമും ഓൾറെഡി പ്രൂവ് ചെയ്തുകൊണ്ടിരിക്കുകയാണ്. നമ്മുടെ സമാജത്തിന് കഴിയുന്ന രീതിയിൽ, നമ്മുടെ ഇൻഡിവിജ്വൽ ആളുകൾക്ക് കഴിയുന്ന രീതിയിൽ ഇതിനെ സപ്പോർട്ട് ചെയ്യണം. അതിന് ഫണ്ട് റേസിങ്ങിൻ്റെ മോഡായാലും നമ്മുടെ ഹ്യൂമാനിറ്ററി ഏത് രീതിയിൽ നമുക്ക് ചെയ്യാൻ പറ്റുമോ അതൊക്കെയും സപ്പോർട്ട് ചെയ്യണം. ആസ് എ നിഷ ഡോക്ടർ രണ്ടാമത് പറഞ്ഞ കണക്ക് തന്നെ മോട്ടിവേഷണൽ സൈഡിലായാലും വാട്ട് എവർ ദ വേ നമ്മൾ സമാജമൊക്കെ ഉദ്ദേശിക്കുന്നത് അത് തന്നെയാണ്. സമാജത്തിന്റെ ഈ ഡോക്ടേഴ്സ് ലൈവ് കൊണ്ട് നമ്മൾ ഉദ്ദേശിക്കുന്നത് ഇൻഫർമേഷൻ എല്ലാവരും പറയും വി ക്യാൻ ഗെറ്റ് ഇറ്റ് ഫ്രം ഇന്റർനെറ്റ് ഓർ വി ക്യാൻ ഗെറ്റ് ഇറ്റ് ഫ്രം എവരിവെയർ. ബട്ട് നമ്മുടെ ഈ റിയലി എക്സ്പേർട്ട് ആയിട്ടുള്ള ഒപ്പീനിയൻ വാക്സിനെ പറ്റിയൊക്കെ വളരെ ഡീറ്റെയിൽ ആയിട്ടുള്ള കാര്യങ്ങളാണ് നമുക്ക് കിട്ടിയത്. ഇത്ര ഒരു വർഷമായിട്ട് പോലും അതെ ഹൗ ഇഫക്റ്റീവ് ഇറ്റ് ഈസ് വർക്കിംഗ്, ഹൗ ഇറ്റ് ഈസ് വർക്കിംഗ് എന്നുള്ളതിൻ്റെ ഒരു മെഡിക്കൽ ടെർമിനോളജി തന്നെ നിജിലും നിഷയും ഡോക്ടറും നമ്മളോട് സംസാരിക്കുകയുണ്ടായി. രണ്ടുപേരോടും സമാജത്തിന് ഉള്ള അഗേതമായി നന്ദി അറിയിക്കുകയാണ്. എല്ലാവർക്കും നിജിൽ ഡോക്ടർ നിഷയ്ക്ക്
ഞാൻ ഒരു കാര്യം കൂടി കൺക്ലൂഡ് ചെയ്ത് പറയുവാണ്. സോ ഈ ഒരു അസുഖത്തിനകത്ത് ദർ ഇസ് നോ എക്സ്പേർട്ട് ഇൻ ദ വേൾഡ് കേട്ടോ. ഡോക്ടർ ഫൗച്ചിയോട് ചോദിച്ചാലും പുള്ളി എപ്പോഴും പറയുന്ന ഏറ്റവും കൂടുതലായിട്ട് പുള്ളിയുടെ വായിന്ന് കേൾക്കുന്നത് നമ്മൾ ഐ ഡോണ്ട് നോ എന്നാ പറയാം, മനസ്സിലായില്ല. അത്രയും ഹംബിൾഡ് ആയിട്ടാണ് പുള്ളി പോലും നിൽക്കുന്നത്. പക്ഷേ സോളിഡ് എവിഡൻസ് ഈ പാൻഡമിക്കിൽ കൂടുതലായിട്ടും വന്നിരിക്കുന്നത് വാക്സിൻ ഫീൽഡിലാണ്. അവിടെയാണ് നമുക്ക് ഒത്തിരി ശുഭാപ്തി വിശ്വാസമുള്ളത്. വാക്സിൻ ഡേറ്റ വളരെ സയന്റിഫിക് ആയിട്ട് പഠിച്ച കാര്യമാണ്, അത് പ്രൂവൺ ആണ്. സൈഡ് എഫക്ട്സ് കുറച്ചേ ഉള്ളൂ, ഉണ്ട് സൈഡ് എഫക്ട് ഉണ്ട്, വി ആർ ഹംബിൾഡ്. പക്ഷെ ആ വാക്സിൻ ഡെവലപ്മെന്റ് എന്ന് പറയുന്നത് നമ്മൾ എൻറ്റയർ ഹ്യൂമാനിറ്റി ഷുഡ് ബി ഗ്രേറ്റ്ഫുൾ ടു ദോസ് സയന്റിസ്റ്റ് ഹു ബീൻ വർക്കിംഗ് ടയർലെസ്ലി. അവിടെയാണ് നമുക്ക് ഏറ്റവും കൂടുതൽ ഹോപ്പ് ഉള്ളത്. ഇന്ത്യയിലും കേരളയിലും ഒക്കെ ഫോക്കസ് എന്ന് പറഞ്ഞാൽ അവർക്ക് എങ്ങനെയെങ്കിലും വാക്സിൻ, ലക്കിലി ഓൾമോസ്റ്റ് 26 ടൈപ്പ് ഓഫ് അതർ വാക്സിൻസ് ആർ ഓൾ ഇൻ ഫേസ് 3 ട്രയൽ. അപ്പൊ അവിടെയും ഒരുപാട് ഹോപ്പ് ഉണ്ട്. സംഹൗ ഇന്ത്യയിൽ തന്നെ ഒരു 3 മാസത്തിനകം ഇവർ വാക്സിൻ പ്രൊഡക്ഷനും സ്കെയിലപ്പ് ചെയ്യും. വി വിൽ സീ പോസിറ്റീവ് സം ലൈറ്റ് അറ്റ് ദ എൻഡ് ഓഫ് ദ ടണൽ. അത് വാക്സിൻ കൂടെ മാത്രമാണ്. അതിനകത്തുള്ള അപ്സ് ആൻഡ് ഡൗൺസ് ഉണ്ടായിട്ടുണ്ട്, ഇല്ല എന്നല്ല. പക്ഷെ അതുകൊണ്ട് നമ്മൾ ഈ വാക്സിനിലുള്ള കോൺഫിഡൻസ് വി ഷുഡ് കണ്ടിന്യൂ ടു സ്പ്രെഡ്. ആൻഡ് ആസ് ഐ മെൻഷൻ ദർ ഇസ് നോ റിയൽ എക്സ്പെർട്ട് ഇൻ ദ വേൾഡ് അബൌട്ട് ദിസ് പാൻഡമിക്. വാക്സിൻ എക്സ്പെർട്സ് ഉണ്ട്, അവരിൽ നമ്മൾ ഫെയ്ത്ത് വെക്കണം. താങ്ക് യു.
താങ്ക് യു ഡോക്ടർ. എല്ലാവർക്കും ഈദിന്റെ ആശംസകൾ നേരുന്നതോടൊപ്പം നേഴ്സസ് വീക്ക് ആയിരുന്നു. നമ്മുടെ കൂടെ വർക്ക് ചെയ്യുന്ന എല്ലാവർക്കും ഒരു ഹാപ്പി നേഴ്സസ് വീക്ക് ആശംസിക്കുന്നു. പ്രിയപ്പെട്ട കുര്യൻ, എന്തെങ്കിലും ഫൈനൽ വേർഡ് പറയാനില്ലെങ്കിൽ വി ക്യാൻ ഗോ ടു ഒഫീഷ്യൽ വോട്ട് ഓഫ് താങ്ക്സ്. സഞ്ജയ് പ്ലീസ്.
Hello, sorry, can you hear me? So yeah, so I hope everyone is staying healthy and well. This is the 39th episode of BMS Dr.Live, and I would like to start off with a big thanks to doctors, our participants, our viewers watching on Facebook, Zoom, and other social media, and BMS members as well. Now, to begin with, a big thanks to Dr. Nisha Nigil and Nigil Haroon. Very valuable and very helpful insights. We would like to have more of this very often. A lot of insights shared on the current scenario of COVID, spreading awareness on volunteering for the AKMG and other charitable organizations to support Kerala in containing and stopping the spread of COVID. And a lot of queries answered on the AstraZeneca vaccine issue, percentage of vaccinations done so far, school reopening, any expected breakthrough like vaccination for the kids, COVID variations originating from different countries, and actively being proactive by taking the first vaccine available, and improving our mental health. Tomorrow we will get out of this lockdown, and having healthy conversations to overcome vaccine hesitancy, clarifying misconceptions. And as Binu also said, our objective is to support in all ways humanitarian fundraising and spreading awareness. Now, so also special thanks to Lena Alex, motivational speaker, renowned career consultant, author of the book Overcoming Anxieties. We'd like to have more of these sessions very often too. Thank you. And a special thanks to our president, Sri Kuriam Prakanam, without whose leadership, effort, and mission, this would not have been possible to run this long. Thank you, Gurinji. And special appreciation to our leadership and our BMS board members, committee members, naming a few: Lada Madam, Joseph Ponasheri, Uman Joseph, Vinu Joshua, Shibu Cherian, Yogesh, Sheila Pudikeri, Jitin, Murali Panikar, Davis Fernandez, Senipen, our sponsors, and all our social media support. So everyone, including our well-wishers, have been very generous with their help, inspiration, and encouragement. We want this continued support, collaboration, and feedback to reach further milestone. We will continue to do our part, and we appreciate the ways our work has intersected with other members. And also thanks for all your comments and engagement on our social media and all. Also, thanks to all our community members, sports club members for your participation and support. A special thanks to medical professionals, nurses, frontline workers. Happy Nurses Day, and also Eid Mubarak. Again, together we have been making our way through a very difficult, tough time. But we are glad to say now we're making real progress. While some countries are suffering terribly in the grip of COVID-19, the economic outlook in Canada has really brightened a bit. Vaccination levels are rising, financial support, physical support is available, the economy is reopening, brighter, stronger economic activity and job creation. Now, but I would like to close by saying thank you. We have been working hard through this crisis, and an enormous amount of work lies ahead. But what we do and what you do is also essential. We provide an invaluable service. We make people's life better, and there's no other higher calling. With this, I would like to conclude today's Doctor's Live session. Appreciate everyone's time, effort, and thank you very much. Everyone have a good and a safe weekend. Thanks.
Thank you, Sanjay. Thank you.
Thank you, Sanjay. Thank you all. Thank you once again, Dr. Lina. Stop the live, please.
Thank you. It was really nice. Bye-bye.